Friends, are you living with urinary incontinence or you are ready to give up urinary incontinence? Friends, are you living with urinary incontinence or you're ready to give up urinary incontinence or urinary leakage? There's a very specific kind of a problem which women suffer, which is called as stress incontinence. Incontinence or leakage of urine when we cough, when we run, when we jump, when we bend for our prayers or bend for work, or when we laugh is something which is exclusively happening in women called as stress incontinence. It is not a mental stress that we're going through. It's a stress that happens to the pelvic floor when we cough, run, jump and laugh. The abdominal pressure transmits to a pelvic floor. Now women have a different kind of a pelvic floor compared to men. And this pelvic floor weakens gradually by age, by pregnancy, by menopause, by age-related changes. And this weakness of the pelvic floor can translate into leakage of urine when a woman coughs. So post-pregnancy, many women would leak urine and may not have been told that this leakage of urine is uncommon but can be treated. Many times women continue to leak urine when they run, when they jump, when they laugh, when they play badminton, or when they probably run to catch a bus. And this kind of leakage is very disabling. Because it's exclusively a women's phenomena, men normally don't suffer from it. Women don't complain. Women live with it, women wear diapers and continue to live with it. They stop drinking water. They probably start mapping toilets and they don't know what to do. But the pelvic floor is not going to get younger. As women cough, run, jump, laugh, they continue to leak urine. And therefore, it's quite underreported, undertreated, underdiagnosed and understudied phenomena across the world. So women from late 20s, 30s to 60s, 70s and 80s, because of age, because of multiple pregnancies, because of menopause and weakening of the pelvic floor can leak urine. And why are Indian women, why are women across the world living with incontinence of urine, which is called stress incontinence? Friends, stress incontinence is completely treatable and curable. It is important for us to wake up to a phenomena where we treat stress incontinence by initially training them on a pelvic floor exercise. The pelvic floor exercises attempt to strengthen. In a younger age, the strengthening is easier. We do pelvic floor muscle therapies, we do EMG biofeedback, we train them on Kegel's exercises and somehow take it forward to the next level where we strengthen the pelvic floor. That's how we do it. So women's pelvic floor is changing every year, every decade, and the change has to be brought to women's health. So post-pregnancy, our gynecology colleagues do that many a times. But when it gets established and it happens that once a week, once a day, once a month, or I have to wear diapers when I go out because I don't know if I bend also I will leak urine. I get up from the bed and I leak urine is not acceptable. Friends, this is a treatable phenomenon and women suffer from this. We will be guilty as medical personnel if we don't ask women in their 40s, 50s and 60s that do you leak urine when you cough, run, jump and laugh? And they would say, we are doing this for last 10, 20 years. We're leaking urine for some time. So friends, stress incontinence is completely curable and treatable. Your urologist will look deep into it. A urinary problem is best treated by a urologist when he listens to you, talks to you, examines you and studies you. Many a times we do the test called urodynamics to assess who you are. And thereafter, the treatment is depending on what stage you are. If you are somebody whose genuine urinary instability is such where the urethra is hypermobile, then we do a mid-urethral sling or we attach a proper sling in the lesion of the urethra to bring about strengthening of the pelvic floor. And that strengthening is what is required. So isn't it time for us to understand ourselves, to go and complain to our doctors as women across the country and the world that we are treatable and curable? Why are we living with incontinence? Why are we living in agony and shame and a lot of dilemmas that we are not getting treated? Friends, stress incontinence is a progressive phenomenon. As age goes by, this only worsens. And soon, while we were coughing, running, jumping and laughing, we were leaking urine. Many women actually would get up and suddenly start leaking urine. So let's work hard on awareness of this topic called stress incontinence with a lot of women who go through it. It's an awareness which is required and women folk in that middle age to elderly age group do suffer. It's time for us to get treated and cured of stress incontinence by a very wonderful kind of a treatment available where we put a mid-urethral sling and give about a continent mechanism and you're cured completely out of diapers. So is it time to live with incontinence or leave incontinence? Is it a time to leave diapers and lead a much healthier life which is not about smelling of urine, leaking urine, having skin infections around? Friends, I'm Dr. Sanjay Pandey at the Kegel and Dhirubhai Ambani Hospital in the Department of Urology in Mumbai and Andheri West. It's important for us to take this subject to the highest possible level for all women who live with stress incontinence. Thank you.